morning. Next, we'll have the presentation of two keynotes, each one with a duration of 25 minutes, followed by 5 minutes of questions. The public can ask the questions that arise in the chat of the YouTube channel. Some of the questions will be selected and will be asked to the speakers in the end of their presentations. Just a brief note about the posters. The posters are available online for consultation and they are organized by category and they can be downloaded. So, for the first keynote, I'll have the pleasure to present Professor Maria Graça Campos. Professor Maria Graça Campos is Professor of Pharmacognosy at the Faculty of Pharmacy, University of Coimbra, and she is coordinator of the Observatory of Drug Interactions. The main topics of research includes drug discovery, especially with B products, and pharmacovigilance in drug interactions, mainly with oncologic patients. Her keynote is entitled Globalization of Beehive Products in Food and Health. So I pass the word to Professor Maria Graça Campos.
Okay, good morning to everyone. Before we go further, I want to thank the organizing committee the invitation to be here today to share with you some data, some thoughts, and some concerns, of course. I also want to thank to all the players involved with the product, of course, including to all my team and all the researchers that I work with. In these next minutes, I'm going to be taking a look at the product's potential based on the research that is already done. And I will show you some of these works around the world. So I will highlight what I see as the main areas of expertise. And to do that, I choose in a random way, as you mentioned, some publications from different countries correlated to different bee products, just to give you a broad idea what is going on around the world. Of course, I could not put all. So forgive me if I didn't put some of your work. I mentioned that some of you that are now assisting have done very good research. And for the others that are just beginning, I did a zip file that I sent to the organizing committee with a good amount of very recent publications. Some are cited in this presentation, but others I didn't have the place to put them because, as I said, they were too much. So please feel free to ask to the organization this presentation that is also in this zip file, and of course all the publications that I put there. So let's get started. When we talk about globalization, of course, we talk about quality. Without that, we cannot move the products around the world, and we cannot have the same function for all of them. So it's fundamental that we have products that are standardized. Be sure about the storage, and of course, to add value to these products, we need innovation. I will talk briefly about some applications of bee products in food and pharmaceutical industry. We have now a good amount of information that is collected for, I could say, more than 100 scientists, colleagues that work in different levels with the bee products. And the standard methods to work with these products are already published in Colosby book, and the ones, the missing ones, pollen in venom, will be published this year. So for standard methods of analysis, we have already a good tool where we can go get this information. Just for highlight, some of the products they are already categorizing as food or as pharmaceuticals. I show you here these Codex Alimentaries that you know. And there we have already a standard method for honey. So it's already classified as a food. However, I hope that in the near future, we could have also bee pollen and bee bread categorizing as a food too, because they have all the potential. What we need is, in fact, do what is already completed. I will show in the next slide. For pharmaceutical purposes, we have also our Holy Bible. So our Holy Bible are the pharmacopoeias around the world. Soon we will have a global pharmacopoeia. We are working on this in World Health Organization. But for now, for example, I show you what we have in the European one. And there we have already three products from the hive. As you can see, we have bee wax and we have honey. Those are the monographs for quality control of these products to be used in pharmacy. And we have also EPIs themselves. So we use them as in homeopathic preparations. And as you can see, we have already hive products introduced in pharmacopoeias, and I hope that all the others could be very soon introduced to for pharmaceutical purposes, because as I will show later on in this presentation, we have a huge potential of these products in this field. In many ways, we are working also in ISO normalization. You know that these norms are not mandatory. Nevertheless, they are fundamental to normalize some of the information that should be done with these products. We have now these working groups. We are Ophelia and myself, we are in bee pollen group. We know that in most of them we have Portuguese people, Portuguese researchers. Thank you all for the nice work that you are doing. And for pollen, we have Ophelia as convener and Wong Liang as secretary. The other groups are more advanced in the norms, so I hope that we can catch them. Well, let's move for foods industry. We have products that are clearly involved in food or as a food because they have an important nutritional content. Otherwise, we can also use them in processing due to these important bioactivities. So I will show some of the examples that we have in a different way that we can use these products. For example, for bee bread, now we are trying to get the best information possible to classify the nutritional content selected by a species, what was at the beginning something that probably we didn't think that we could do. But in this work that we published with colleagues in Romania, we were able to identify clearly the species, the origin species. So this was one sample of Brassica and another one from eucalyptus in different regions in Romania, what means that we can go farther in the use of the product if we classify the floral origin and we'll have a reproducibility of the product. For pollen, we know almost everything that we could know about pollen. Research in pollen is already, I could say almost complete, because we know so many things about the nutrients, the micronutrients. Sorry, I missed here the vitamins. I'm really, really sorry. And we know lots of bioactivities, as I will show in the next minute. With pollen, we know already clearly very good amount of floral origins. They are distributed around the world. And for all of them, as I will show, we can get important bioactivities and clearly application in industry. For example, we have this work that we did with Ethiopia. We have here coffee and tobacco pollens. They are very, very specific. And here we have coconut pollen. And Brazil, for instance, have tons of these products. And some of the research carried out is anti-tumor. So we have important application of these products in the industry. Moving to processing. When we want to get the best of a product, we need to get the best of the bioactivities, and the storage is fundamental to be sure that we get at the end the same bioactivity that we have at the beginning. These colleagues from Bragança and from Castelo Branco, they did a very important research exactly showing the importance of frozen bee pollen to get the best prevention of oxidation for lipids, for instance. And this allowed to use this bioactivity in innovation. And for innovation, what they did was compare the conventional antioxidant with the pollen itself and the extract. They are black puddings and very typical in Portugal. And they verify that these two products could prevent better than the conventional antioxidant. They verified that bee pollen was a little bit more active than the extract. This happened many times. However, depending what we want to do in industry, in my point of view, sometimes it's better to use the extract because they are more easily to standardize. And I think it's a very good application for some of the compounds in bee pollen. Janka and our group also did a similar essay, but with cookies. In this case, we had, as in the other one, of course, we had compounds, and these compounds can fortify the products. What is quite interesting, when she was working with us, we did a work with beer. It's not published yet, but probably in the next conference, I can show you this data. So as I said, we have other examples in the bibliography, and we can see them in this zip file where I put some of these papers. Well, going forward, I think that everyone knows honey. What can I say that you don't know already? It's clear that we have a high content of sugar, but we also have some micronutrients. I leave here just a paper from Morocco, just to show you that, as I said, I choose different countries around the world. We have lots of information about honeys from different countries. And this is really good because each of these countries can explore the flora that they have. And coming back, what I was saying is, for example, a good application for honey is in dehydrated people. So you can dilute the honey and give in the water because will help even to restore the intestines microorganisms. Well, now my field, because as you know, I work in pharmacy, so this is more my area. For all these products, I will base the next slides of this presentation in this chapter that I wrote with Ophelia and Helmedy for the book No Bees, No Life. And also in these two papers, this one I wrote with the colleagues from China and Turkey in Italy about royal jelly. And for bee pollen and bee bread, it's a joint venture with Romania and Turkey. Well, I must say that I use the materials that we have that we prepared to these papers. So some of the tables look smaller. I didn't want to cut them too much, but I highlight what are the main points to think about. And you also have these papers in the chapter in the folder, so please feel free to get them. Well, for walks, we'll start with walks. Walks, as I show you at the beginning, is already in the pharmacopoeias, not in only in the European pharmacopoeia, but in many others. What we have here are mainly glycerides, fatty acids, and long-chain alcohols. So it's easy to understand that this mix gives a product with a very good stability, didn't vary with pH or moisture levels. It's wonderful to be used in pharmaceutical technology due to the hydrophobic matrices that can be used in drug delivery, in tablets, suspensions, implants, and microspheres. So a huge potential in pharmacy and in fact can add value to the product. Moving to royal jelly, we did a comparison among the main compounds in different products of Beehive, but what is important here is that once again, we need to have clear information about the species, the floral origin of the product. This will change a little bit in the amounts and kind of components that we'll have inside. In this scheme, we can see clearly how we do drug discovery. So we start the main matrix. We check the compounds inside. We split in different isolated compounds. And after yes, we can go to the bioactivities. So we have here antimicrobial, home healing, some information about the possibility to use as anti-cancer, what are the compounds that we can use for. And this is the way to go. Otherwise, the results are not reproducible. We can have always the same thing with the same product if we don't have this information rationalized and well categorized. So the main bioactivities for royal jelly, as we classify for the information that we have more, are antioxidant activity, wound healing, immunomodulatory, and anti-aging. As you can see here, we also know already what are the main mechanisms of action. And this allowed us to go further in development of a new drug, because otherwise we could not establish the efficacy, the toxicity. So if these compounds are not safe, we cannot use them for drug discovery. Sorry, I need to take some water. Well, as I said, I think the most of us know lots of things about honey, but I could not moving forward without talking about the work of Peter Mullen. Peter Mullen is a professor from New Zealand. I had the opportunity to work with him when I was there. And he was the father of the application of honey in wound healing, with all the information that allowed us now to have in the hospitals the bandage that we can use in burns, in surgical wounds. And in fact, it was a good step and an important step in the evolution of this product. Of course, all this research was carried out with Mitasia, endemic from New Zealand, Manuka. But for example, for phenols and flavonoids in Poland, the compounds are very, very similar to our eucalyptus. I think that maybe someone could do similar research here. Well, another application that usually we attribute to propolis is the antiviral activity. But we also have good data for the same use with honey, in this case in herbs. For propolis, please be careful with the preparation of the extract, because some of the compounds can infect induce allergies in skin. So before apply in the lips, anything that could cause allergy or even give some color to the skin should be taken out. Well, I work in Poland in Bibrev, as you already have understand, I think. So I will detail a little bit more this data. We did in this paper some tables, long tables, by the way, but I just choose some of the information from them about the main bioactivities, that we have a good correlation among the original floral origin and the bioactivities. You have here some examples for the anticarcinogenic bioactivity: brassica, cistus, salix, anti-inflammatory also. And for cistus, in fact, we have good data about the activity in osteoporosis. You know that this is a kind of problem that nowadays it's important to help in this therapeutic pathology. Well, with this pathology, with other tools in therapy. So it's very important if we could develop a drug using these extracts. For the hepatoprotective activity, the data that we get are from Castania and Brassica pollens. However, I must alert that all the hepatoprotective products that we have, didn't matter if they are these ones or extracts from plants, or even chemicals prepared just by synthesis. They are products that when they act in the liver, they can produce drug interactions. So if people are taking drugs, please avoid this kind of product. Otherwise, something can go wrong in the therapeutic. Well, moving on in these bioactivities for bee pollen and bee bread, we also found a huge activity antimicrobial. I think that is the kind of bioactivity that is crossing all the products in beehive. And we have lots of data for these different microorganisms and also for huge variety of floral origins. In Portugal, we have a nice group working on this. So they also get lots of information from different species and with different microorganisms that we can use honey, honey, of course, and in this case, bee pollen. Another bioactivity that is quite explored in lots of products and also in bee pollen is the antioxidant bioactivity. In the most of the cases, this bioactivity is due to flavonoids or phenolics in general. What is important is that nowadays we have an increase in degenerative pathologies, Alzheimer, Huntington's, Parkinson, arthritis, and the possibility to use compounds with antioxidant power, it will be possible a way to go. So recently we wrote this paper for the Huntington's disease. This is a genetic mutation that induces this disease. So we don't have a cure for this pathology, but we can manage to delay the symptoms of the disease. And for the other pathologies that I showed before, Alzheimer, Parkinson, arthritis, probably we could use the same way to go. So here we discuss the application, the use of dietary flavonoids, in fact, to help the patients with this pathology. And of course, as I said, we can apply for others. Another new application is the use of bee pollen, and in this case, in a mix with propolis, to reduce neuroinflammation in a model of autism. Here they use the effect of a prebiotic rich diet in this model to decrease neuroinflammation. However, please take care when we extrapolate this information for humans, because the use of prebiotics, probiotics, or even the symbiotics when we put all together is not yet well proven. So we know exactly if they stay in bowels, in the intestines, and they can exert the effect that theoretical we think that they do. Now, the last bioactivity is antitumoral. As you know, we have also an increase in oncology. We have lots of patients and new, better and more antitumoral drugs are in fact needed. So some of the information that is now carried out with this product and even with the others that I will show are fundamental to achieve new drugs. We have already some clinical trials going on, but we still need to go and to do lots and lots of much more to complete the data that is needed to can have these new drugs. We have other products from behind under this investigation, as for example, propolis. Our colleagues from Bragança are also doing a wonderful job on this issue. And another product that is explored with this bioactivity is hepatotoxin. Mainly at the beginning, we use it for relief pain or chronic inflammatory diseases, but we have already information in some papers that we can explore the anti-tumoral activity with success. Helmedi with the colleagues from Bragança are also in his PhD degree exploring these potentials. So as you can see from these hive products, we can have a possibility to develop important drugs for health application. So just recapping, importance to have a floral origin or the identification of the product. Standard methods, I think we have already a good work done. Normalization, we are going, we are completing the data sooner, I think. And of course, with all this, if we validate the bioactivities, we will have an important add value to this product. Thank you so much.
Thank you, Professor Maria Graça Campos, for this excellent review on the bee products. So now, before going to the questions, Professor Graça shared with the Congress organization all the material used in the presentation. If someone wants to consult, just send an email to the Congress organization. So now we'll pass to the questions. So I'm going to ask, I don't know if we have questions from the public. I think no, but I'm going to ask some. You clarified the potentials and the handicaps in the use of the bee products. But in your opinion, what are the main handicaps, or which steps we have to overcome to pass from the studies in the laboratory to the use of the consumers in the health area, for example?
We need to clarify. So I cannot use, for example, bee pollen directly or propolis or epitoxin in oncology, of course. So for health, if I want to use in oncology these products, it's clear that we need to isolate the main compounds that are responsible for this bioactivity, and we need to carry all the steps. So finish all we have already done and go to the clinical trials, and after, of course, we can develop a drug. Otherwise, we have, for example, the possibility to use honey to hydrate people, as I said at the beginning. In some cases, in nutritional point of view, we can have these products as bee bread or bee pollen because they have a high nutritional content. However, for homemade is what you want to say. We can use these products homemade just in our home, or just going to the industry, because they are two different things.
Yes, I know, but it's like in all things, we see a lot of scientific works telling this propolis is good for this, bee pollen is good for this. So there's always a big handicap between the scientific, the information that goes out from a lab and then to the consumers, the use of the consumers.
Well, I think that in this century we should move on with all the data that we have from research. We should move on from the traditional medicine and validated these products with all the safety information that we have. Imagine, for example, what I said for propolis that we can use for antimicrobial activity. In fact, and you work on that. But if I have an infection, I will not take propolis. I will take antibiotic that is already prepared in the right formulation. So I know that is the efficacy and the safety for these dose that I need to take to fight this infection. So for me, it's quite difficult to use. I know, and I apply a few things in my family, let's say, and I also give lectures in phytotherapy. So I teach how to use some medicinal products, but we need to be very, very careful with the side effects and the toxicity. And for example, propolis is very good, but it's also very toxic. As for example, epitoxin, okay, is differently if I talk about honey or if I talk about pollen. Those are clearly products that I can use with a nutritional value. And in certain cases, I can use them to give a little bit more of bioactivity. It's the difference if I want to, so the big idea is we have an homeostasis in our body that should be put in certain levels, okay? If I have a small imbalance on this homeostasis, I can use some of these products. But if the homeostasis have huge differences in labs, I need to use drugs, proper drugs that I have the right dose and I know all about the side effects. And even in these cases, I can have collateral effects that are not very good. My concern is more, imagine that we use one of these products and we have an important side effect. This will kill the product. This goes in the news and will kill the product. So we need to be very careful with the advice that we give to population to take these natural products just to cure without a good reflection.
So we have a question from the public.
Okay.
Are there standardized tests for the antibacterial properties of honey and for wound healing?
Wound healing.
The first is antibacterial properties.
Okay. We don't have these, I think, in Colosse. Anyway, well, yes, you have. We have for pollen, not for honey, not for honey. In the Colospi book, and I think is free for consultation in the web. You can go for these chapters. I don't know if they have for honey, but we have for bee pollen. By the way, was this part of our chapter was written by Leticia and some of their collaborators. So yes, we have there what we propose as a standard method. So what we did was looking in all the methods that were already published and select what could be the best one to be used by all the researchers. Yes.
Okay.
Healing. I don't remember to find anything.
Okay, so we don't have more questions. Again, I thank you for the excellent presentation, and thank you for being present here in this Congress. Thank you.
Thank you too. Thank you. Good luck.
Yes.